my name is Connor Howes and today I'll be completing ACVN Practical Assessment 11, Packing Kits, Instruments and Autoclaving. Before we begin, we have washed our hands thoroughly with hot soapy water to reduce the amount of contaminants and bacteria on my hands. I have also correctly gathered all of the equipment here in the processing area. Before we begin, I have also wiped down the table here with a non-link cloth to remove any of that foreign debris or contaminants that may be on the table. And we will begin now by lint rolling the drape completely to remove any hair, any visual contamination, or any lint that may be left on the drape from the last wash. It is very important that this is done in the processing area to ensure the workflow of clean and dirty instruments is upheld to limit the amount of contamination that may occur or coming into contact with the clean instruments here. And it ensures that one does not pass over the other and has the potential to mix with clean and dirty instruments. Okay, very happy with that one now. Discard that in a moment. So now with the hand towel, we want a concertina fold. So we want to bring that one over and back in, tucking in all the sides whilst we do it. Bring this one over and back in, and then with the concertina. So we'll put that one to the side. Now we will get the drape out of here and we will get our general spay kit now and we will separate it. So I'll put the suture needle to the side, scalpel blades, and then we want to organize our instruments. I'm not necessarily the best with identifying what instruments are needed in the kits. I understand there need to be mosquito forceps, some Kelly hemostats, some Metzaban scissors, maybe some Babcock forceps as well. We need a spay hook. When I sort the kit, I like to put them all with the same sort of instrument. So all of the tower clamps together and they're all put to the side and opened. Then we have all of our hemostats here, and we want to make sure that they're all opened. Our right tooth forceps here. Great, they're all looking clean, no water spots or marks, and everything's looking well there. How I like to organize the kit is from biggest to smallest. As per our clinic policy, we place them on the spay hook, from the largest to the smallest, kind of grouping the instruments together. Here at the clinic, we use our color-coded tape. I understand that this is not ideal and is not gold standard, as the color-coded tape can harbor bacteria and microorganisms under it as well, or it can become quite brittle after many cycles within the autoclave. So as we are using this as our identification measures, this will need to be changed every month. I understand that it is gold standard that we have kit guides or photos available within the clinic to be able to use as an easy reference point, just to double check and make sure that nothing is missed when we are wrapping the kit. So they're all looking good. They've all been checked for completeness, functionality, sharpness, to make sure they're working. There's no corrosion or pitting and everything looks really good. All the box locks and ratchets are open. There's our kit all been sorted here, and now I will grab, as per our clinic policy, they like to lay one swab down completely open horizontally in the center of the drape. Grab the spay hook here and we will grab all the larger instruments. So the largest instruments we have here are the needle drivers. I place this spay hook down first on a right angle, so it is lifting up, and you can easily thread through all of the other instruments. I should also discuss whilst I'm here the packing of hollowware. So when we are packing hollowware, it is very important that they are not stacked together, as this will make that they are not completely sterile and clean in the autoclave. They must be packed separately to ensure that steam penetrates all the way through and all the surfaces are sterile in cleaning the interior and exterior of the bowl. The opening must be facing the paper, not the plastic, as this ensures it will have contact with the steam and become sterilized. And it is very important that it is placed on its side, so the bowl needs to be placed on its side in a draining position. Our scalpel handles and our right tooth forceps. Then, as per our clinic policy, we take 10 swabs each side. So we want to be methodical with this, making sure that it is exactly 10. 10 on the left, and 10 on the right. Grab our clean suture needles here, so that's 3 straights, 3 half curves, and 3 curved as per our clinic policy. We then place our scalpel in the middle there, and our lint rolled folded hand towel on the left. Then we would be placing a sterilization strip, and it would be placed right in the center of the pack. So this is how we would correctly package our kit here in the clinic. We don't use any kidney dishes or any storage containers inside the drape here. It is just as you see. We place the drape in a diamond formation on the table, and we place the kit here in the middle. We then want to get this bottom drape here, this bottom corner, and we want to bring it over the entire drape, making sure, and I like to pull it down at this point because there is a lot of excess drape. We then want to bring back that triangle, that bottom corner for a concertina fold inwards. We want to grab the other side, and we want to be holding our hand on the right side of the kit here, bringing over the right side all the way, making sure that it is nice and tight there. Watch the top as well, make sure that's all crisp and lined up. Move that one back for a concertina fold, and you want that right corner facing inwards. So I like to hold my hands here as a bit of leverage. Pull that one all the way over. Bring that left corner back. And again, we want that left corner facing inwards. You take our most important corner, the top corner, and we bring that all the way back. I do personally find that it is, once I have pulled the corner all the way over, to turn the kit, and now you want to tuck in that top corner underneath all of those already previously folded drapes. And you want to then tuck in all the sides. You then want to grab some tape, and you want to paste it on the top and bottom ends, making sure that you are not covering that tab which you've already made of autoclavable tape, because this will show that it's correctly reached the correct steam penetration. And now we label it. We don't want to be labeling the on the drape at all, as this will seep through. It must be on the masking tape. So this was a yellow spay kit and my initials. So we have correctly wrapped the kit there in an envelope fold. It's very important that you want to be very careful and gentle in it, especially because it doesn't have any kidney dish and they are loose contents. So slide that one in, making sure that it is not tearing in any way. Now we do the corner fold down first, the corner fold there, and we bring that one over. And this is where you will have to maneuver your hands and make sure they're not becoming undone. And then we want to lift gently. All be taped, and then we'll place that one there. As per our clinic policy, we do place a little tab on the side here, just to allow easy access for the nurse assistant that will need to sterilely open the bag. Textile drapes are not suitable as a primary packaging only. Non-woven drapes are the gold standard. However, it must be packed in a laminated pouch to ensure that it is not coming into contact with any steam. They may be damp, they can retain soap particles, and it is not a suitable microbial barrier. We will then place a small little bit, as per our clinic policy, another bit of autoclavable tape on top. I will just show you now. So I've sealed it all there. It's all been looking good. I can't see any air pockets. There's no tears, no rips or holes. None of the seals are coming undone along the perforated edges. It is very important that when we are using the chemical strip, that we are not placing it flat against an instrument, as this can give it a false reading. We must place at least 2 minimum, so we would be placing one inside the middle of the kit and then on the outside here. It must reach the pass line. If it doesn't and it reaches the fail, then it will need to be repacked, re-sterilized and re-autoclaved. So when placing our kits out for sterility, as per our clinic policy, we place it on the treatment bench here, which is just to the side of the autoclave here of the bench. We don't want to put it on the sink the bench here because it does have a sink and it may get wet, or water spots may splash onto the kits. So we do just set them at the side here. So now I'll be individually packing some surgical instruments required for sterilization, and then I've got all the appropriate equipment required for this video. So now, before we begin, we want to select the appropriate size laminated bags for sterilizing. I understand that we should be using one smaller size bag and one larger size bag for aseptic presentation for the surgeon. However, as per our clinic policy, they only advise that we use the one laminated pouch. Steam will have to penetrate through the paper, not the plastic, and you want to make sure that steam can penetrate the entire surface of the instrument. So, our clinic does not use tip protectors for scissors or any sharp implements, so I'll be demonstrating now with a piece of gauze here, which we wrap over the end here, just like a nice little cusp. I've got some tape, and we would just tape that around. This helps to protect the scissors from piercing the bag, and also helps to protect the surgeon who will be grabbing onto that instrument. So now, when we are placing them in the laminated bag, we want to make sure that it's the handle or the rings facing up, and that is the side that the surgeon will be grabbing. Now, when we go to wrap it, we want to make sure that we are folding along the dotted line, making sure it is completely closed and absolutely no air pockets are forming. It doesn't require an indicator strip, as the indicator is already on the pouch. That one there, and then we want to write on it. So one pair of scissors. Today is the 28th of the 8th, and the date. Now we'll do the same with the hemostats. We want to make sure that they are open, the ratchet is not closed, and the box lock is completely open. Again, we want to make sure that the rings are facing the surgeon. Now, some more bit of tape. So, I've checked for package integrity and sterility. I'm very happy with all of that. None of the seals are coming apart. The laminated pouch is completely intact. And now I have both of them ready to go. Autoclaving. So you just want to open the door first. You then want to give it a good wipe out using a normal cloth, and you want to make sure that you're getting every side of it. So the front, all the buttons, getting the back as well. This gets rid of any foreign debris or build up of dust that might be left in the autoclave as well, making sure that it is clean for the next cycle. So you can remove the tray now and put that on top. Then you want to be checking the seals. You want to make sure the seals are tight, they're not frayed, they're intact. Then you want to put this tray back on in, and you want to make sure that the tray is level when being placed in. You want to make sure the door can close fully. As you can see, nothing is on top. I check the water level now. Great, there's about 80% full of distilled water there. No vents are occluded, nothing's on top, nothing's around the vents here. And now, close the door, and we'll get that one to preheat. So now that has to preheat for 30 minutes to warm that up. So we're looking for cycle number 2. We want it for 121 degrees for a 15-minute holding time. Great. Fantastic. You want to make sure that none of the buttons are flashing as well, so the door's not open, the water level is not empty, and it doesn't need to be drained at all. We want to open the door. Slide that one in now. Now we'll close the autoclave there. You want to make sure when you are placing kits in, you're only doing 1 to 2 kits per cycle, and you're placing the plastic side facing up, as it does not retain any moisture. Great, and we'll start that one now. It is imperative that it completes a drying cycle after the autoclave cycle every single time to ensure that the packs and the items inside are completely dry when being removed. I have applied correct PPE. I understand I should be wearing protective eyewear or a full face shield to protect from residual steam buildup within the autoclave, and I understand that we should be having to forearm autoclavable gloves as well to remove hot packs from the autoclave. However, this is the gloves that we have here. So as per our clinic policy, and understand that it is not gold standard, we'll open the autoclave door slightly and we'll leave it for 30 minutes to cool. So now 30 minutes has passed and we'll remove the packs from the autoclave. So we want to be very careful when opening the door. Just grab the packs. You want to make sure that they're completely cool to touch, and they can be touched there. And you want to be placing them plastic side down. It is very important that it is plastic side down. If it is paper, it will allow for condensation and the item will be considered not sterile. We'll close the door. When checking for the packs, you want to be checking that the tape has not become undone in any way. The indicator strip has reached the pass line. The autoclavable tape is black, which is fabulous. There are no air pockets that I can see. There's no wetness or condensation. It is very important that they are stored within surgery, preferably behind a plastic screen as a gold standard. They must be kept in a dust-free, vermin-free, and clean area. This to influence the sterility of the packs here. Can be excessive dust within the storage area, wet packs, incorrect storing of the packs as well, incorrect storing requirements of the packs. Stacking packs on top of each other as well can hinder sterility and the humidity level within the area that they are stored at. But other than that, that is everything today. That is Practical Assessment 11, Packing Instruments, Kits and Autoclaving.